My name is Ashley Olp of Olp Family Medicine of Carmel, and today we're going to be talking about perimenopause and menopausal symptoms. So perimenopausal is the time period in a woman's life leading up to menopause. So for a few years prior to actually becoming menopausal, you start to get some of the hormonal fluctuations and hormonal changes that take place that gradually will lead to true menopause. Perimenopause is a kind of a symptomatic time that occurs before menopause. It's usually a result of hormonal changes, and it can lead to a lot of the symptoms that you hear women talk about on a regular basis. So your cycles can be shortened, they can become heavier during that time. Some women experience mood swings, weight gain, hot flashes, and that eventually leads into menopause. And by definition, you are not in menopause until you have not had a cycle for 12 full months. So that your cycles can kind of come and go for several years. And sometimes you may skip 3, 4, 5 months at a time and then suddenly have a cycle. So if that happens, you're not in menopause yet. You're not officially menopausal until you've had no cycles for 12 months. And the symptoms of perimenopause then escalate a little more. And menopausal symptoms, particularly hot flashes, can go on anywhere from 7.5 to like 11 years after menopause. So it lasts a long time, and it can be very uncomfortable for a lot of women. So perimenopause and menopause are not disease states. We sometimes treat them like they are, and they can make you feel very bad, but perimenopause and menopause are very natural states. And so when you ask the question, how does a woman get this? All women are going to get it. If you're a woman, you'll get it. And you can't avoid it, but essentially it's usually age-related. Most women start to experience symptoms somewhere in their mid-40s. And on average, in this country, on average, most women are fully in menopause by age 51 to 51 and a half. But it can range broadly, anywhere from early 40s into late 50s. So when you ask the question, how does a woman get this? She just has to get older, and she's going to get it. Yes, so when I have patients come in that are really symptomatic, whether they're experiencing mood swings, hot flashes, sometimes joint pain and stiffness, if they're still in the perimenopausal phase, so still having cycles, we would normally regulate that by manipulating hormones, either with birth control. Sometimes antidepressants can be used for some of those symptoms, including hot flashes. And then there are various minor surgical procedures that can be done for really excessive heavy bleeding. Once somebody is menopausal, then hormonal manipulation kind of goes out the door, and we would do hormone replacement therapy if needed. So anymore, the only real indication for true hormone replacement therapy would be if somebody's having menopausal symptoms that are so severe, it just really reduces their quality of life and reduces their functioning. We no longer would use it for disease prevention. At one point in time, 15 to 20 years ago, it was used for disease prevention. We thought it reduced the risk of things like heart attacks and strokes and chronic heart disease, Alzheimer's disease, and it turns out it actually increases the risk for all of those things. So I would never recommend hormone replacement therapy for anybody in menopause unless they were having unbelievable symptoms that dramatically affected their quality of life. So if you find that you are experiencing severe symptoms in perimenopause, there are multiple options for treatment. So I can go through with you the pros and cons of hormone replacement therapy, who's a good candidate, and whether or not you're a candidate for it, the pros and cons of bioidentical versus pharmaceutical grade hormone replacement therapy, and then other non-hormonal options. So you don't have to use hormones to treat perimenopausal symptoms. And it kind of depends on what the symptoms are that you're having. But we can use antidepressants to treat some of the mood swings, the irritability, the anxiety. Insomnia is a big part of menopause. And believe it or not, even hot flashes can be treated with antidepressants. They're not quite as powerful and effective for hot flashes as hormones are, but they also don't come with some of the risks that hormones come with. Insomnia can be a big problem in perimenopause, so sometimes we use progesterone for sleep. You can get progesterone in topical creams that gets absorbed through the skin. You can also get it in oral forms, like lozenges that get absorbed underneath your tongue. And also there are non-addictive prescription sleep aids that can be used to help sleep that don't have any hormones in them as well. So So that would be some non-hormonal treatment options. The hormonal ones we kind of already talked about, bioidentical versus pharmaceutical grade. But I would want to go through what your health risks are and make sure that you're a safe candidate for hormone replacement therapy before we did that. If you feel you're struggling with the symptoms of perimenopause or menopause, come and see me at Old Family Medicine, and I can go through your options with you regarding hormone replacement therapy and non-hormone therapies to help you work through that struggle.